So we are delighted to be here with you for the second Café in the Future of Care for Children with Medical Complexity virtual Café series. It's Humanism in Clinical Care to Meet Whole Child Family Needs. My name is Bethlyn Houlihan. I'm a discussant today and co-PI for the project. I am delighted to be here with an excellent colleague and co-author of the paper upon the basis of this Café is coming from Dennis Quo. And we've also got Meg Camo, who was the senior author on the paper and is co-PI with me for this virtual Café series. Next slide, please. And we are very, very grateful to have this funded generously by the Lucille Packard Foundation and their partnership, their support, the shared sense of purpose. It's all just extremely humbling. We're grateful. Next slide, please. I want to tell you a little bit more about this series, just as a reminder that we're really trying to foster interdisciplinary dialogue for meaningful systems improvements for CMC. So we have 60 minutes. We try to make 25 minutes of that facilitated discussion in breakouts so that we're really getting people together and able to dig deeper into some of this. There are family partners that co-lead every session, and we have discussion questions and analysis that are created by an interdisciplinary faculty. Next slide, please. And speaking of interdisciplinary, we have Café registrants. This was as of Friday, and we had another 30 that registered since, but just to show that there's breadth and to the roles that we have of people that are part of the CMC community and part of the systems of care. About a third are in the healthcare sphere, and then another quarter are in the people with lived experience, family leaders, advocates sphere. So that's exciting for the discussion and for us all gathering here today. Next slide, please. So speaking to you about the discussion format, we're going to ask that people, but we're going to have a lot of people here today, so we can raise your hand via Zoom right in the chat box. Both are really equally valuable because we're recording this, we're pulling in the chat, we're pulling all the sources that we have available to us to develop a thematic synthesis and analyze with the support of AI to represent the themes and to represent everything that you're telling us today. Next slide, please. So to be able to participate the best that you can, you want to make sure you mute, and everyone's doing a fantastic job with this already. And if you would like to raise your hand, you can see that reactions on the toolbar, and you can find raise your hand there. If you have any technical assistance needs, you can definitely private message Mitra, M-I-T-R-A. So you can find her and private message her. Next slide, please. I want to start just by recapping the first Café that we had. We started with where we are now and where we need to go. And as you can see from this graphic recording of that from our fantastic graphic artist, Karina Branson, that we started from the CMC coin project, which I'll speak about in a moment. And we wanted to broaden and deepen the conversation from the learnings of that project. And we started there with nothing about us without us, family partnership, and then getting into 3 different systems level questions. And those questions were answered in the domains in which you could intervene of policy, practice, research, and sustainability. So we're creating a package of materials from that we can then share out with you that gets into like the larger picture, high level, but then also organizes things into more of the specific strategies that everyone's ideas generated and that we all came up together with our expertise in interdisciplinary discussion and dialogue and chat and written responses after. And we'll share that out on Friday and on our website. Next slide, please. So today's discussion is based on materials that we sent out that were part of a supplement that we published in the Pediatrics in January, which we're very excited. And that's a jumping off point for the Café today. So Meg can put the link into the chat that gets you to the supplement where these 2 papers can be found so that you can take a deeper dive into them. And right now we're just going to do a very high level. So next slide, please. Just to remind folks, the CMC coin was a collaborative improvement and innovative network to advance care for children with medical complexity. It was a 4-year project, 2017 to 2021, funded by HRSA with 10 state teams with the shared goals to improve the quality of life for CMC, well-being of their families, and cost effectiveness of their care. Next slide, please. along those lines, we had a measurement work group to figure out how to measure those things. And they told us existing quality of life measures for well-being measures just were not cutting it. They're too medically focused. They were biased. So family leaders that were on that work group said that. We created a work group of family leaders from all 10 state teams, and Meg Camoes, who is here, was an PI on that project. She was part of that group and created a focus group guide to ask about child quality of life, family well-being, and how care teams could support. We implemented this over several years with 27 family-led focus groups across 10 state teams, so 127 families, which is fantastic, and then did our analysis. Those numbers allowed for very nuanced analysis, and the family-led groups gave a sense of safety and trust to really allow families to share their authentic experiences, and that was key. Next slide, please. So I want to lead first with what we led with in the focus groups, because the family work group asked us to do this to make sure that we were really centering each family's humanity and honoring the inherent value and wonder of each child, medical complexity or not. So I would ask if everyone could please chat your responses to what brings you joy in raising or providing care for a child of medical complexity. And when you share that in the chat, you could also include who you are within the CMC community. I would love, I know folks are going to have fantastic responses, and I really don't know, I want to be able to do honor to those by reading out just a few. So what I'd love for us to do is for folks to think and then chat what occurs to you, and we can capture this and include it in our thematic synthesis. So I want to just take a minute and allow folks the opportunity to do that. And for all of us to just absorb it as we see it coming in and just sit with that for a minute. Yeah, as I thought, these are very moving. I'm very grateful, and please continue to put these in so we could represent these stories and humanity and the true reason for all of what we're doing here today. Next slide, please. So why humanism in care delivery? Oh, it looks like there's a stray quote that made it on there. I really do want to use family's words, so I'm going to ask next for Mitra. So sometimes when I was asked about my daughter's quality of life or issues that she was having from her disorder, I was responded with, and it's hard to talk about, well, you do know that there's no cure, right? There's nothing we can do. And then when you look at family well-being, next. Why do you keep saying I'm so strong? And then I feel like if I show my weaknesses and everyone's like, whoa, like pity, I don't want you to have pity. There's a fundamental reality in families' experiences that came out, and for people with lived experience, that human life is not really being valued in systems of services, that it's dehumanized. And families experience this daily. It's pervasive. There's an emerging evidence base that this has a real impact. It has impact on outcomes and trauma. So there's a sense of isolation that comes out of this, distrust, the sense of needing to fight all the time, of only being the only ones truly looking out for their child. There's power dynamics. You can feel invisible, and like the expertise as essential caregivers is being dismissed. And families will say it's not their child, but the system's shortcoming that create the burden. Next slide, please. So with all that in mind and what we were sharing in the chat, that just does a beautiful job of centering this. What is humanism? It's just to give us kind of a base level. So it's really any system in which human experiences, values, and dignity predominate, right? So every person in the health system, caregiver and provider and patient alike, is first and foremost a human being. So when you're doing this, health professionals care about their patients as much as they care for them, and recognize that compassion can be a powerful catalyst for healing. That system's dehumanization is dehumanizing for everyone. That shared moral distress that providers feel is often profound. And we all agree that this is key, right? But we feel kind of powerless at times to know what to do about it. And that's kind of what we're going to talk about today. Next slide, please. So how can humanism drive ideas for care changes? So one of the things that this frame does is it brings the breadth of human experiences families of CMC say drive quality care. So joy, compassion, human dignity, shared humanity, creativity. And they say it's tied directly to outcomes. And you see that in these quotes. and in this article and in things I'm going to share with you. And as we see on this nice systems pyramid, you have the things at the top that we'll get into in our facilitated discussion and where we can intervene. But then you've got the things in the middle, relationships, and then you've got mental models. And those relationships, that's all the people. And systems of care are literally made up of humans that are providing this care, right? And the people receiving it and being a part of directing it and driving it. And then you got your medical models, which is mental model that we're shifting to social models of care. And humanism really helps to keep that all in one sphere. Next slide, please. So now I want to share this from families' perspective in their own words, what it looks like. First, creativity for a whole child. Ask a question like, is he able to get in his gait trainer for baseball, or are you having a hard time to understand what we're trying to get their bodies to do? Maybe we can just medication. So these are things like this, all of these, and then this article that we ended up distilling out of the findings from those focus groups are the most important and most missing according to families. So that's what we were trying to describe and use their own words. And this creativity for the whole child is a way of valuing like the human dignity of each child and the unique factors that bring them joy, that bring quality of life and thriving. We also uncovered, when you get to the next two around family well-being, that families had a universal hunger for improved relationship and compassion. And so you can see in the second one, relationship and trust, where a physician has asked me how I'm doing. I'm so surprised I just start crying. You would think that my child's provider would care more about how parents are doing. To just know that I'm that vital in my child's life. So providers are very unique for families. They speak highly of the ones that they have and some care teams, but it's just inconsistent. It's not right there for them all the time. And yet providers can understand things that others can't and break through some of that. And that humanism includes how both provider and family feel and interact together. And then the next one is partnership and communication. He called me beforehand. There was a conversation. He was trying to understand exactly what that was important to us. And then the last, the undervalued power of family-to-family support, just hearing from other parents to be able to talk about the lows too, to not feel so alone in it. So the good thing is, the next slide, that this is not something we need to reinvent the wheel around. There's first and foremost, families help us set priorities. So if they're partners all around and we're inviting from family-led organizations, then you learn where to shift, because we have valuable resources and effort and time and energy and everything that we need to know where is the right place to put it. And families are telling us. And it's both interpersonal skills and structural elements, and it's teachable. It's in the tables. Families are very clear about it, and we see it in the tables in the paper. And this actually it also involves providers taking care of their own wellness, very important. And most elevated by families was palliative care, separate from hospice. And there are other examples here too of ways that we can things we can draw upon to really operationalize humanism. And you can see that in the next slide, please. Tables like this, and Dennis is going to go into very specific things that how this looks in practice. And I'm very excited to introduce him now to do that. Thank you.
Thanks, Beth, and hi, everybody. What I want to do for the next few slides is just give folks some thoughts about what this may look like in practice. And we're really interested in folks' experiences, thoughts, reactions, because, humanism we didn't actually go into this paper, writing this paper, looking at the analysis saying, we're going to write a humanism paper. This really just rose to the top because of the way that we as a team approached the focus groups and the questions with the values and principles that really are fundamental to the work that we do. But I do think that I'm excited that we have the opportunity to discuss and just frame this as, this is really about humanism. Go ahead and do the next slide. We want to give you some thoughts about how to translate all this to practice. I want to share a few reflections about my own career. The first is that I give a lot of talks about systems of care, but I really start with values and principles, because the values and principles of affirming human dignity, human rights, and social justice for kids with medical complexity and children with disabilities are really fundamental to the work we do. And when we look at systems, it's not just the processes, it's not just the components, it's the values and the principles that give us really the direction for systems go. And then we as stakeholders need to look at where our individual leverage points are. The second box, the one in the middle, is just the roles of where we are trained to be able to think through these situations in ways. All of this is completely trainable. I've had the privilege of working with colleagues, not just fantastic colleagues in pediatrics, but also maternal and child health. And I think just that breadth of experiences, including experiences I've had working with a lot of community partners, really informs a lot of the frameworks of why humanism. But I also want to point out the importance of coaching and mentors in this work. And one person that has influenced my thinking in this area, I actually have to go back to when I was a fellow, Dr. Janet Serwent, who was the president of the Academic Pediatric Association in 2012 or so, actually made humanism an essential pillar of her presidency. And there is a nice article about her address where she really outlines that there's a difference between professionalism and humanism, which is really about the core empathy and emotions and compassions of just being. And the third is the power of stories. And I want to take the opportunity to share some brief stories with you about several patients that I have had the privilege of being part of their lives. And just to give you some thoughts about how humanism may have played roles in my interactions with them. Next slide. Um, but something that I have also completely heard through the years is when we talk with families, the first is I hear a lot of we'll make it up as we go along because there's not really a pathway of what we need to be doing. The next is that statistics, we talk about statistics and research, and ultimately statistics don't mean anything when it comes to my own child. The third is I have to figure all this out myself. The fourth is I have to fight for everything. The fifth is that I'm waiting for things I'm supposed to have. And the sixth thing I have here is I'm not respected. And I would say it's pretty clear that we've got some work to do to make sure that the system really values humanism. Next slide, please. So I want to give you a few little anecdotes of these are composites of patients that I have encountered throughout really like the last 15 years. The first set of patients are 6-month-old twins where one has a significant developmental delay. The other did not have significant developmental delay. But we value all of our kids and affirm the dignity of humans, and we can't treat them any differently. We have to make sure that we raise both up. And so we had a lot of discussions about uh, attachment, about attention, and ensuring that that the family was supported in being able to address both their kids' needs. The second patient was an 18-month-old who was not growing. She had a feeding tube. By the numbers, she looked like would have been growing. And this experience was that we had a lot of conversations, and it began to revolve around being a child, being a parent, and the joy of raising a child. And then the parent disclosed that what the parent had been telling us about the feeding schedule was not actually happening consistently. And that led to a discussion about a routine and affirmation for the parent's love and joy for the child and vice versa. And the child grew after that. The third child is a 2.5-year-old who was hospitalized with a tracheostomy, but was not allowed to go home because of standards of care for having 2 trained caregivers. And the parent was very specific that the child was not pulling the trach out at home, but the child was pulling the trach out in the hospital. We had a lot of discussions after listening to the mother and work with the mother, and we had to get attorneys for the hospital involved to really just kind of cover everything. But the child went home and the child did well, and the child was decannulated a year later. The fourth child is a 4-year-old in foster care with a feeding tube, agitation, a lot of this was really supporting and listening to the needs of the foster parent who was a grandparent who really needed a lot of supports that needed to be translated to what she needed. And the fifth child, as a 10-year-old who came from out of state, was on a lot of medications, but what we did was unpack the fact that the child was being bullied, was really in a very challenging situation. And by affirming the child's strengths, the child actually came off all their medications. And an interesting follow-up is that not only is the child more heavily engaged in school at home and thriving, the child's cognitive testing actually went up, which I think is a testament to affirming the joy of childhood. I think that is the last slide, and I wanted to turn it back over to Bethlyn to just see if there are questions or comments or reactions before we go into the breakouts. But I wanted to just present this to you as just food for thought and to really challenge each other about just this is the joy of why we all went into the professions, what we did, and this is the joy of celebrating each other with compassion and empathy and joy. Thanks.
Thanks, Dennis. I'm actually going to hand it over to Meg. She'll kind of facilitate. She's our lead facilitator today. So she'll start us out. And you can go to the next slide, Mitra.
So if no one has any questions for Dennis, I guess we can go ahead and jump into instructions, but I want to double check and make sure that we're good. Anyone have anything that's burning? Okay. If anything comes up, please feel free to put it in the chat box. I think Bethlyn mentioned earlier that we automatically get a transcript of everything that goes into the chat box, except when it's a private chat to someone else. I don't think we get those. But we do get everything else and we save those, and they are part of the record of our conversations today. I wanted to give you some instructions for what's going to happen next. If you were able to join us for the first cafe, you may have remembered that we had a really robust turnout of folks and we hadn't planned on doing breakouts. And so we tried to moderate a discussion with about 200 people. So instead, we're going to try an experiment today and go into breakouts so that we can have smaller groups and maybe be able to go into a little bit more detail with one another. Where each of the breakouts are going to have two co-facilitators. There is one person there who will start off with question number 1, and then the other person will take question number 2. And if we have time to get to question number 3, that'll be great. But we really hope to get to the first 2 questions. We'll have about 25 minutes to have that breakout conversation with one another. The chat is just as valuable for capturing your thoughts and your ideas and your questions and your challenges and your successes as verbally speaking during this breakout session, because again, we're saving a transcript of everything that goes into the chat. And we know that even with a smaller group, we're not going to have an opportunity to be able to get to everyone who has something important and something wise to say. So please don't hesitate if you're a shy person and you'd prefer to chat. If you are a person who was raised well and you worry about being rude and interrupting, go ahead and use the chat. If you're a person who would like to provide us with an essay, go ahead and use the chat. We would love to have all of that wisdom and information and perspective available to us as we later synthesize the learnings and the perspectives that we hear today. All of the individual breakouts, both the chat and the audio, will be synthesized after the cafe and packaged and shared out. And the central place to find the information from each of the past cafes and the future ones coming up is on our website. And we will put a link in the chat for you just a little later to find that. When we come back after the breakouts and we're back in the big room here all together, the second co-facilitator, who is always a family leader, will offer one suggestion for a highlight that they heard in their individual breakout. It will come from their perspective, and we would like to privilege that. But then again, all of the perspectives will be represented in the materials that we share out after the cafe. You can also, during that time when we're back in the big room here together, share your own individual highlights in the chat. We would love to know what got elevated for you, what really stood out for you, what was a key learning or a key takeaway for you. So please don't hesitate to use the chat then as well. Bethlyn has pre-assigned participants to individual breakout rooms. So hopefully it'll be a relatively smooth process of choreography, getting you all into your breakouts. Mitra is going to stay here in the main room in case you run into any problems or questions, technical problems. You get thrown out, you come back in, and you need to get back into your breakout room. She'll be available to help you out. Finally, if you were not already assigned to a breakout room pre-registration, say you may have been a little late in registering, you can go ahead and join any of the breakouts that you wish. You can just pick a room and jump in. When the little prompt pops up on your screen that says join a breakout, go ahead and click on that, and you will be sent to the right room. I think those are all the instructions you told me to give, Bethlyn. Is that right? Did I forget anything?
No, I think you got it. And then we just got, we're really trying to consider what we can that's is getting to actionable, and how do we help to operate? How do we help move things forward? So we're want to make sure we're all together in what understanding the problem, but there's been a lot of considering that. So what we want to do is see where are the threads and the places that we can try to grab onto and start really moving things forward, and do that together with this fabulous interdisciplinary group. And we already got great comments in the chat. I think, Mitra, next slide. Yeah, so this is just essentially everything that Meg did an excellent job succinctly saying. I'm going to now, unless there are any immediate questions, but please keep the comments coming. You can also do that in your breakout groups as part of the conversation. So I'm going to open up the groups. Welcome back, everybody. The time, I don't know how it was for newer groups, but the time goes by very fast. So we're just giving people a moment. I think everyone's back. And Meg, I want to hand it to you for group share out. And I don't think we need to leave the slide up. It'd be nicer to just see each other. I don't know what you think, Meg.
Yeah, that sounds great. It'd be great if we could all see each other a little bit more clearly. I don't get everybody's Brady Bunch square on my screen. It's just not big enough, but I certainly have a lot of you, so thank you so much. I think what we want to do now is see if our family facilitators would like to share one key takeaway from the conversation that they had in their breakout. And I'm going to call on folks individually, and please don't kick me. I'll go in alphabetical order so that nobody feels put on the spot. You'll be able to be prepared. Adenike, you are up first. What would your main takeaway from the breakout that we both attended be?
Do I really have to pick one?
I know, there's so many riches and treasures to choose from.
Right. So I think one of the major things that stick out was knowing you have competing priorities, making sure that the providers are very mindful that sometimes those competing priorities are not, it's detrimental to have those, but also to acknowledge that you need those for care. Because how would one push the other if sometimes you can't be on the same page? You have to be on a different page until you can catch up. That's what I heard, and I really appreciated that comment.
Thanks so much. Thanks so much. And I'm going to turn to Anna next, who will share her, front of mind takeaway from her breakout. But in the meantime, if any of you all individually have a key takeaway that you'd like to make sure that we get on the record, please don't hesitate to chat it in. Anna?
Hey, everyone. Gosh, there were so many great points stated. And, I heard some really fantastic quotes like, joy comes from earning the trust of families. And as caregivers, and I mean, as healthcare professionals, and I think that's an important point. Another one I heard is healthcare is good at dehumanizing care. And that for me brings to mind that first impression that hospitals make and healthcare givers make on the family and the child. It sets the tone, right? Of am I the caregiver, I mean the healthcare provider, going to treat you, patient and family, as humans, fellow humans, and have compassion and empathy, and not just look at you as lab values and x-rays and such. So I think those are beautiful reminders that humanism is a really important part of complex medical needs and making that difference in the healthcare field.
Thank you so much, Anna. Well said. I'm going to turn next to my friend Carolyn.
We had so many really good comments. And I think we heard some of the same things that Adenike and Anna have shared. One of the other things that came up was, and I really have to say I love this, presumption of competence, that not underestimating the patient and the family, and recognizing the expertise in the room. And to add on to what Anna said, recognizing that we are all people.
Thanks very much, Carolyn. And last but certainly not least, Shauna, would you like to jump in next?
I would love to.
Thank you.
Yeah, I would say our discussion group echoed all of those sentiments as well. But what I loved hearing was that we had some providers that shared some of the great work that they're doing to involve families, some of the unique ways that they're involving families through calls, questionnaires, surveys, that kind of thing. But really the resounding message that through our discussions was listening, active listening for everyone within the group, of hearing what families need, hearing whether or not that is, possible within their family dynamic, listening to hear those family dynamics that are at play there as well, and how to best support those families through that active listening.
Thank you so much. Those are all really great. It sounds like we're going to have a lot to wade through when we get the transcripts and the recordings from each of these individual breakouts. We're going to start to think about wrapping up now because, as you know, sometimes we start our meetings maybe a little behind schedule, but we always end on time. Future Cafe topics, we have policy opportunities coming up next in July. This is going to be an exciting conversation from someone who looks at policy from the sort of national level and thinks about federal policy a lot, but also state policy. And then we'll also have an example from a person who lives in a state who is where a lot of work has been done around policy opportunities being leveraged on behalf of improving care delivery for kids with medical complexity and their providers and their families. So we'll be excited to hear more about that and hear your policy needs and opportunities and how you have experienced leveraging policy opportunities and where you see the need for the field to go next. Bethlyn, I believe, is going to pop a link into the chat if she hasn't already, in order to both learn more about the Cafe series, our webpage that I referenced earlier, and also a link to Cafe number 3 for the registration link. Please remember that even if you can't make it to one of our Cafes live, if you register ahead for the meeting, you will automatically get all of the information that comes out about the webinar, about the Cafe afterwards. So please do register to attend the third Cafe, even if you are not 100% sure yet that you'll be able to attend. We'll have your contact information. We'll be able to make sure that you get everything from it. The evaluation link has just popped up in the chat box. There was also one of those little Qualtrics things that came up just a second ago. If you could please make sure you do the evaluation. We made it as short as we possibly could, but it really means a lot to us, and we really do use that information to improve the next cafe. So please put in your information, put in your kudos, put in your suggestions for improvements. Especially, please let us know how the breakouts went. This was an experiment we tried this time with a group this size, and we hope it was a good one for you. But if there are ways in which we can improve, we really want to know that. I want to thank Bethlyn and Dennis sincerely for their contributions to setting us up, the conversations that we had in the breakout. Thank you both so much. And I have to say that I am incredibly impressed that both of you were able to stay on time with your slide deck. That's really something that is unusual and rare in this kind of a setting, but well done you. We would love to take questions that people would like to ask of us individually. Our contact information is shown on the screen now. Please don't hesitate to email any of us anytime. If it's about the Café series, I would suggest coming to Bethlyn and myself. If you have questions, though, for Dr. Kuo about his discussion and his slide deck, and the experiences that he's had in integrating humanism into his own practice, I'm sure he would love to hear from you as well. So with that being said, I'm going to turn the floor back over to my friend and colleague, Bethlyn, who will send us on our happy, merry way. And thank you all again for your time and for your contributions and being with us today. Bethlyn?
Thank you so much, everybody, for the depth of conversation. I think that this, with a question around how do we, if we start from humanism, how does that change how we think about how we design care? And we've really had a great discussion around that. It will feed into what we're doing in the future. If you have any other thoughts, please add them. The evaluation includes the questions from the breakout. So if you have any other thoughts that come up, feel free to throw those into that evaluation so that we can continue to capture and use that in the thematic synthesis that we'll be sharing out. And we look forward to seeing you the next time around, and reach out to us anytime. It's so wonderful to see faces we know and faces we don't, and be a community together and really across disciplines. And thank you. Take great care, and we'll be in touch soon with the materials from this one.
Thank you all.
Hi, everybody.